Okay.
So I'm going to check my order before I come in my room. I'm going to gather my supplies and I'm going to put on my proper PPE. I'm going to have my goggles out here and I'm going to put them on right now. I've got my mask on and then I'm going to knock and come into the room, shut the door for privacy. I'm going to have done proper PPE and my goggles are going to fog up really, really bad. Okay. I'm going to check. I'm going to introduce myself. My name is Jaquel. I will be your LPN for the day. And I'm going to check 2 patient identifiers. Their name, their date of birth, and their ID number. And my patient is the right patient. I'm going to once again check my order to make sure that I have orders for suctioning this patient. I'm going to check my patient's respiratory effort, their respiratory rate. I'm going to listen to their lungs and I'm going to check their oxygen saturation. They need to have suctioning done. So I'm going to explain what I need to do. I am going to suction out your trach to help relieve you of some of your secretions that you've got going on. And then I'm going to reassure my patient that this is going to be uncomfortable, but we need to help them breathe a little bit better. And that I would stop if I felt that they were in respiratory distress. I'm also going to ask my patient if they are in any pain. If they are in any pain, I'm going to give them pain medication 30 minutes before the procedure. Then I'm going to raise my patient up to a comfortable working height. If my patient was unconscious, I would have them roll over and they would face me. They're going to be up in a semi-Fowler's position, but our patient is a little bit rough to insert catheters and put a new dressing on. So we are going to lower the bed rail. I'm going to check. I'm going to turn on my suction. Make sure that it is between 80 and 100 millimeters of mercury. I'm going to put on a waterproof pad on my patient. I'm going to make sure that they don't have any questions before I start this. So, hand hygiene. Again, so I'm going to open up my catheter kit, open this away from me, and then open this. I'm going to take out my stay. I'm going to open my little cup. Stay. This little cup is not. It's been open too many times. So I'm going to flip this on my trash can just a little bit. And then I'm going to come over here and fill this up. Put this back on, set it off to the side. Okay. I'm going to remove my patient's oxygen. And it's kind of in the way for my friend here to record. So maybe I'll set it up there so it's kind of so you can see a little bit better. I'm going to open this up. Oh, it's gonna stay. It's gonna stay. Normally I would get different size gloves because these ones are way too big for me. And then, okay, I'm gonna take out my catheter. And then this is my non-dominant hand, so I'm going to use this to stabilize my trach. I'm going to, not that one, this one. Insert. And I'm going to check for suction in my sterile water. Then I'm going to, how do I word this correctly? Okay, so I'm not going to occlude this as I insert it. I'm going to suction between 10 and 15 seconds each suction pass. I'm not, as I insert this, I'm going to be careful not to touch any of the other edges, and I'm going to occlude this as I pull it out. So as I insert, I'm going to go down to the predetermined length that the doctor has ordered, and then I'm going to, I wouldn't do this, but I don't know how else to do it right now. I wouldn't have done that.
It came out?
Yeah, it like came apart. Okay, so I'm going to occlude this, twisting this back and forth for 10 to 15 seconds. After I've hyperventilated my patient before I do this. And he's in a super awkward position.
Yeah, he's rough.
Between 3 and 6 breaths between each, before each suction pass and after each suction pass. I'm going to clean out my secretions. I can do this up to 3 times in an episode. That just seems weird to say, but, and 10 to 15 seconds between each one. I'm going to have them deep breathe and cough between each suction pass. I'm going to hyperventilate between each one, and then if they need their oxygen supplementation between each one, because some patients do, I'm going to put that on between each one. But my patient is okay. Okay. And then if I needed to do this 3 times, I would do it 3 times because my patient, depends on how much my patient needs it. Clear out my secretions, and then I'm going to do oral care and clean out my patient's mouth. I would never go back to their trach after I've done their oral care. So I'm going to remove this, but I need it later, so I'm just going to set it right here. And then put my patient's oxygen back on while I do this. I need that stuff later. So then I'm going to do my hand hygiene, and I'm going to put on other gloves, and I'm going to do oral care for my patient. I'm going to make sure they got like their chapstick and stuff, make sure that they're all set that way, and I'm going to listen to their lungs again and their words, oxygen saturation, respiratory rate, effort. I'm going to make sure that's all good and that they're not in any distress before I put them back down into a safe position. I would lower my bed back down, and then I'm going to make sure they don't have any questions. I'm going to clean up and document my procedure, and then I'm going to wash my hands 800 times. You want me to do the next one then? Okay, so I'm just going to set this off to the side. And then, okay. Did you just pour it in there?
For lack of a better place.
I know, right? Okay. All right, so we've already identified our patient. We're going to go on to our tracheostomy care. So we've already identified my patient. I've introduced myself. My patient is not in any pain. They do not need pain medications at this time. I'm going to lower my bed rail so I can reach my patient better. I left that there on purpose. And I've got my goggles on, my PPE, and I'm going to